We know coronavirus was spread in hospitals during the first wave of the pandemic. In fact, 11% of those who died contracted it there. And today, it seems, nothing has changed. One of the reasons? Because staff are not routinely tested. This doctor might not want to be identified, but he does want us to tell his story. He says the hospital where he works is playing fast and loose with the guidance.
We can carry the virus asymptomatically, and that's a major worry if we start taking it onto wards where we have very vulnerable patients who may be immunosuppressed or very elderly. Those sort of patients, it could be catastrophic.
The sad truth is patients are contracting COVID in hospital.
The most recent figures reveal of the 13,000 new hospital COVID cases, nearly 1,800 of them were acquired in hospital. 765 of those were in the northwest, and although there were only 700 new hospital cases in the southeast, it has the highest proportion of cases caught in hospital. Nearly a quarter of them were caught there. The worst performing trust is Tameside and Glossop. 20% of cases caught in hospital were there.
Marlene Schofield went into hospital with a bladder infection. Her son says she got COVID while she was there and died 6 weeks later.
She wouldn't have gone to hospital, she would have still been there now. No, she wouldn't have caught the COVID because she was shielding at home. But she died because she went to hospital, the way I look at it.
And how did that make you feel?
Quite angry.
Hospitals in high-risk areas are supposed to regularly test all staff to ensure the virus doesn't spread on the wards. This nurse, who works at Barnsley Hospital in Yorkshire, told us it is not happening.
We're not routine testing anyway, which is a Tier 3 area. We should be routine testing everybody, but we're only routine testing where there's been outbreaks of the pandemic within the hospital.
The hospital trust insists it tests all its patients when they arrive. Tonight, NHS England has confirmed all staff will now be routinely tested in every hospital, even those without symptoms. It's what they want and ultimately could help save many more needless deaths. Emily Morgan, News at 10.